He is also a principal involved in the development of a breakthrough for the treatment and prevention of senile cataract, which I'm sure is going to be one of the keynote lectures of our conference. Please welcome Dr. Mark Babizhayev.
Dear Chairman and esteemed colleagues, first I would like to thank the management of International Anti-Aging Systems and the third Monte Carlo Anti-Aging Conference for its kind invitation. My lecture proposed for your kind attention is titled Lipid Peroxidation as a Possible Cause of Human Cataract, and acetylcarnosine as a potent ophthalmic drug for the treatment of human cataracts. Senile cataract is a vision-impairing disease characterized by gradual, progressive opacification of the lens. It accounts for over 50% of the world blindness population and affects some 17 million people. As such, early clinical detection, close monitoring, and surgical intervention are important in the management of senile cataracts. Worldwide, 28,000 new cases of cataract are reported daily. In the United States, over 1.3 million cataract operations are performed annually at a cost over $3.5 billion. However, in developing countries, there are simply not a sufficient number of surgeons to perform cataract operations. Therefore, a significant number of people are permanently blind with cataract. The slide presents typical appearance of the human cataractous lenses above two images, which are yellowish opacified human lenses. Rabbit and bovine, larger, on bottom transparent lenses. The conformational change during cataractogenesis leads to the formation of aggregates which scatter light to produce opacification. For that reason, an aggregation process was proposed as the main contributor to cataractogenesis. Another way opacity is increased is by the amplitude of the density fluctuations, which means an increase in the refractive index difference between the scattering unit and its environment. The lens is washed by the aqueous humor in the eye, which contains about 4 micrograms per milliliter of high-density lipoproteins, ascorbate at extremely high concentrations, which in the presence of transitional metal ions evidently take part in the renewal of lipid composition of the lens. The oxidative modification of lipoproteins in the presence of trace amounts of transition metals, copper or iron, is variously associated with lipid peroxidation, and the oxidized lipid moieties can be implicated to lens toxicity, triggering cataractogenesis. The disciform eye lens continues to grow throughout life. The fresh fibers developing by elongation from cubic anterior epithelial cells are continually laid down in the equatorial zone. The older cells in the anterior and posterior cortex and supranuclear cortex gradually lose their nuclei and become more and more compressed in the central nucleus of the lens. The typical clinical localizations of human cataracts are presented on this slide. It is known that protein aggregate formation in the lens is accompanied by an intrusion of lenticular fiber membrane fragments into cytoplasmic fraction. Since in a transparent lens most lipids localize in membranes, we have suggested that the process inducing the damage of lenticular fiber plasma membrane lipid bilayer takes part in the aggregation of crystallins. Among endogenous processes which can cause injury to membranous structures of cells and tissues, one of the most important is lipid peroxidation. Cataract is found primarily in older individuals. Approximately 25% of the population over 65 years of age and about 50% over 80 years of age. have serious loss of vision because of age-related cataract. The large and growing number of people blind with cataract and the significant complication rate has motivated a search for a pharmacological treatment of cataracts. Based on our studies in animals, rabbits, dogs, and clinical studies in humans with age-related cataracts, the N-acetylated form of natural dipeptide carnosine has been proposed and patented in our study as suitable and physiologically acceptable for non-surgical treatment for senile cataracts. Although cataract surgery is generally recognized as being one of the safest operations, there is still a significant complication rate. Between 30 to 50% of patients underwent cataract extraction surgery in the United States tend to develop opacification of the posterior lens capsule within 2 years and subsequently require laser treatment with its own additional significant rate of clinical complications. Since the number of cataract operations is so large, even a small percentage of complications represents a significant number of individuals. Other complications, including retinal detachment, corneal edema, corneal transplantation, and endophthalmitis, can also lead to rehospitalization and further treatment. Thus, aside from secondary cataracts, about 26,000 individuals develop serious complications as a result of cataract surgery annually in the United States alone. The considerable discomfort experienced by patients as their vision diminishes and the complete loss of accommodation resulting from the surgical removal of the lens should also be recognized. Besides the risk of complications, an artificial lens does not have the overall optical qualities of a normal lens. Thus, although surgical extraction of the involved lens is generally effective, there is a considerable interest in identifying the risk factors and the search of the beneficial therapeutic remedy as the possible protective strategies. In our work, the role of free radical-induced lipid oxidation in the development of human lens opacity was studied. Physicochemical parameters of the lens fiber membranes at different stages of cataract have been investigated. The deterioration of lens fiber plasma membrane structure preceding formation of large aggregates in lenticular matter leading to lens opacity was observed by electron microscopy. What are the changes in membrane ultrastructural organization? The electron microscopic observations have shown that while the lens still preserves its transparency and protein aggregates cannot be detected in its tissue, the earliest changes in regular longitudinal lens fiber plasma membrane structure did occur. They form typical knobs and sockets. These undulations of the lens fiber cell plasma membranes are the manifestation of the normal lens aging. Consequently, the lens opacification is preceded by the deterioration of the lenticular fiber plasma membrane ultrastructure. Following opacification progression, the lens fibers become more irregular. Their electron density increase, the membranes form numerous diverticular twistings, you see, interdigitations and fragments. Then further membrane fragmentation and an increase of the membrane fragments curvature are observed. The slide shows typical wave-like membrane structures forming multiple hurls around electron-dense centers. Such undulating structures, different by a number of different forms, expand eccentrically from the lens fiber. Such formation has a string of pearls-like shape. At the mature stage of cataract, which is biochemically characterized by large high molecular aggregate formation in the lens, ultrastructural characteristics of membrane lesion is distinct, with the lenticular fiber plasma membrane twisted fragments becoming the central mass of amorphous electron gray debris and globules of different sizes, from 100 to 900 nanometers. and electron-dense granular contents. At the same time, fiber and membrane structure could no longer be identified, and fibers appeared to have been converted to extensive masses of globular structures. First, smaller globules, 100 to 200 nanometers, filled with granular material, probably of protein nature, of about the same density as the lens fiber cytoplasm form, and then intermediate-sized globules, 220, 500 nanometers, containing aggregates of high density and dispersity appear. The loss of lenticular fiber-free membranes is probably connected with the aforementioned membrane involvement in the protein aggregation. The larger globules, more than or equal to 600 nanometers, seem to develop from the small with the intermediate globules. At the later stages of the lens opacification, the globules become more and more coiled and aggregated, and intermediate filaments disappear, as obvious. At this stage, the lens matter is filled mainly with protein aggregates. Significant scattering of light accompanying the protein aggregate formation depends upon the incident wavelengths of light in relation to the size and the concentration of globules. Within the region of the posterior subcapsular opacities, a striking transition was observed from areas of normal lens fibers wherein the proportion of membranes per unit area was greatly increased. The processes appear to be formed by elaborate corrugations of the plasma membrane. Multilamellar body structures composed of concentrically arranged membranes were identified in a number of regions. These were found in relation to zones of disorganized lens fibers. These structures resembled myelin figures of the multilamellar storage bodies found in the events of lipid metabolism disorders. More tightly packed structures with a membrane periodically appeared to lie free in space, lacking in lens fibers or fiber remnants. Bottom image, please. A common feature seen on this image is that the membrane structure could no longer be identified, and the fibers appear to have been converted to masses of globular structures, roughly circular in cross-section, and of varying size and electron density. The membrane-bound structures of spherical cross-section and high electron density located within the masses of Morganian globules varied in diameter between 60 and 230 nanometers. We have shown in our studies that the light scattering of the cataracts lens comes primarily from fiber cell membranes, which have a higher refractive index than the surrounding cytoplasm. When fiber cells are regularly packed, the light scattering of the whole lens is minimal. Modification of fiber cell membrane architecture gives rise to the light scattering and cataract progression. Dialdehyde bifunctional reagents are characteristic of lipid peroxidation products, and their interaction with free amino groups entails sheath base forming and subsequently inter- and intramolecular crosslinks. The specific fluorescence, you can see on the right, of these products has been registered by us from the human cataracts lenses in the human eye in situ. Of course, other products of free radical oxidation like quinuranium derivatives make input into the intensity of this blue-green autofluorescence of the human lens with cataract. Further, evidence was obtained that the protein aggregation process in the lens comes from the lipid membrane damage followed by its fragmentation. Consequently, as a result of lipid peroxidation, phospholipids modified with oxygen appear in lenticular fiber membrane and are able to increase the plasma membrane hydrophility and to impair lipid-lipid and protein-lipid interactions. Detergent action of the phospholipid oxidation products accumulated in lenticular fiber membranes offer an explanation of the observed curvature changes of the lens plasma membranes. Phospholipid molecules modified with oxygen incorporating themselves into the lipid bilayer change its geometry, diminishing the area of its hydrophobic portion and increasing plasma membrane deterioration. This effect obviously forms basis of membrane fragmentation and formation of cataracts. We noted the accumulation of lipid peroxidation products in human cataracts. The results of determination of the lipid peroxidation product, different molecular products, revealed in the lipid extracts from the lens are shown here. It is evident that the content of the hydroperoxides having conjugated double bonds are determined by characteristic maximum in UV spectrum and 230 nanometers. Increases at the initial stages of the opacification up to almost mature stage of cataract. Here, the consequence is the same. The opacity area is 55 to 64% opacification degree. This is assessed by a quantitative morphometric analysis technique. However, at the further stages of mature and hypermature cataract, the lipid peroxidation primary molecular product level drops a little. At the same time, determination of the content of anti-fluorescent products in the lipid peroxidation sheaf basis determined by lipid extract fluorescence intensity at 430 nanometers, fluorescence excitation 365 nanometers, revealed an increase monotonously by cataract development. The anti-fluorescent lipid peroxidation product concentration in the lens correlates strongly with the opacity degree. An important regularity was revealed in our studies. Accumulation of the lipid peroxidation products depends on the cataract development stage, but does not depend on its kind. I mean age-related, complicated, diabetic, allowing to presume a universal role of the lipid peroxidation in the lens opacification process. The results of determination of total thiols and the content of lipid peroxidation products for the same lenses show that with the development of cataract, the level of the total thiols of the lens fibers rapidly falls with intensification of the free radical oxidation reactions of lipids. The presence of high correlations between the degree of clouding of the lens, the level of the final lipid peroxidation products, and the concentration of reduced glutathione and total thiols in the lens shows that the transparency of the lens, the concentration of the lipid peroxides, and the thiol level in it are interrelated parameters of a single process. Content of the polyunsaturated fatty acids in the lens is rather moderate. Hence, direct registration of their decrease in the course of lipid peroxidation is quite difficult. Evidently, to register directly an increase of oxy products in unsaturated fatty acids is of rather great importance than to reveal a decrease in the fatty acid content. As a result of the fluorination procedure of the lipid oxy products in the human lenses, we have monitored the in vivo lipid peroxidation process in human cataracts using gas chromatography technique with electron capture detector. Typical chromatograms of lipid fraction from transparent and cataracts below mature cataract human lenses are shown. Although in mature cataract on gas chromatographic profiling of the lens, lipid samples show that no principal in new peaks appear, the intensity of peaks markedly differs from the norm as quantitative ratio. However, a reliable increase in the intensity of the peaks, whose retention time does not correspond to the fatty acids non-oxidized standards, most probably reflects the fact of the increase in content of oxiderivative polyunsaturated fatty acids in cataracts. Here's this quantitative stable data. It has been established that the development of cataract is accompanied by the formation of various fluorophores in the lipid fraction of the lens. These lipid fluorescing products have been chromatographically separated according to polarity and molecular weight. It is shown that the initial stages of the development of cataract are characterized by the appearance of lipid fluorophores with low polarity and a small molecular weight. The maturing of the cataract is characterized by an increase in the intensity of the long-wave fluorescence of the lipids in the blue-green region, 430 to 480 nanometers, and by the formation of polymeric lipofuscin-like molecular weight fluorescent lipid products with high polarity. Based on the above data and on the resemblance of liposoluble fractions of animal lipofuscin pigments, the role of lipid peroxidation in the genesis of human cataracts has been proven. The study of cataract formation raises a question: whether the modification of the lipids, which are the minor component, only 2% of lens wet mass, can lead to conformation and solubility change of proteins constituting 35% of the lens wet mass. In other words, whether the lipid peroxidation process is a factor which, together with other metabolic shifts, only accompanies the cataract development, or in a number of cases, whether the lipid peroxidation activation can be an actual initial cause of the lens opacification. In our study, a possibility of cataract induction with phospholipid peroxidation products was examined by the injection of oxidized liposomes into the rabbit vitreous. You can see typical posterior subcapsular cataract in rabbit. Out-oxidized phospholipids did induce cataract after their injection, with the concomitant accumulation of the lipid peroxidation products in the lens and the reduction of the lenticular glutathione concentration. Injection of saturated phospholipids, which are resistant for peroxidation in the same concentrations below, did not induce any lens opacification. That is the evidence of the initiatory effect of the lipid peroxidation products in cataract formation. Such modeling of cataract is based on a type of clouding of the crystalline lens similar to that observed in cataract, posterior subcapsular cataract, resulting from diffusion of toxic lipid peroxidation products from retina to the lens through the vitreous body on degeneration of photoreceptors. Our modeling of cataract was based on the polymerization of the secondary lipid peroxidation products of the dialdehyde type presented in the vitreous with the lens crystallines. Dialdehyde bifunctional reagents can interact with free amino groups forming fluorescent products of sheaf-based type and subsequently intramolecular crosslinks. Phospholipid intramolecular crosslinks have been registered in the study by characteristic fluorescence of lipid extracts from cataractous lenses. It is important that the accumulation of rather small amounts of oxidized lipids in the lens is sufficient to induce cataract development. This being true, preventing accumulation of peroxide compounds in the lens and also maintaining a high level of reduced glutathione, we can prevent further development of cataract and in a number of cases even restore partially the transparency of already opacified lens. What are the activities of antioxidant enzymatic and non-enzymatic systems of the crystalline lens? The crystalline lens is acting not just a mechanical optical lens system to focus the incident light on the macular retina, but it rather represents an active metabolic system equipped with enzymatic and non-enzymatic antioxidant defenses and can withstand the oxidative stress-induced damaging influences, deleting the pro-oxidant agents from the surrounding aqueous humor in the eye. The ability of transparent and cataractous human and animal lenses to metabolize hydrogen and phospholipid peroxide in the surrounding medium was evaluated in our published study. Since the hydrogen peroxide level in the aqueous humor of the anterior eye chamber in cataract reaches 82 micromole, the hydrogen peroxide concentration in the incubation medium of the lens was chosen to be 100 micromole. Typical kinetics of the hydrogen peroxide decomposition by the lens is presented. It was found that the hydrogen peroxide concentration in the control solution without lens remains stable and virtually constant for 100 minutes. A considerable fall in the hydrogen peroxide level was observed over the course of time after the addition of the crystalline lens to the medium. since larger normal lenses, rabbit and human, have more epithelial cells which are primarily responsible for decomposition of hydrogen peroxide. These lenses catalyze the composition of hydrogen peroxide more rapidly than the tiny mouse lenses. So lens behaves as a metabolic system. During the examination of the temperature dependence of the rates of hydrogen peroxide decomposition by the normal lenses, it was found that the absolute values of reaction constants increased during a rise of the temperature. The increase of constant is of linear character and can be shown to be about 0.03 micromole per minute per 1 degree Celsius in the temperature interval from 13 to 37 degrees centigrade. The abilities of lenses to catalyze the decomposition of exogenously added hydrogen peroxide in a bolus of 100 micromole were estimated on the basis of the time taken to reduce hemiluminescence of hydrogen peroxide by 90% of its initial value. The data correlated well with the results of hydrogen peroxide determination by the photometric technique. The effectiveness of hydrogen peroxide decomposition by lenses with cataracts was reduced. With an increase in the relative area of opacity of the lens, the rate of hydrogen peroxide decomposition fell from 200 to 300 nanomoles per lens per hour, characteristic for transparent human lens, to 65 nanomole per lens per hour for the ripe human cataracts. This was reversed by the addition of reduced glutathione to the incubation medium. We found that the ability to metabolize hydrogen peroxide is not diminished in early cataracts. This argues that disturbance of the redox balance in the lens on this stage of cataract is not severe. Incubation of the mice lenses with the initial concentration of hydrogen peroxide of 100 micromole led to partial depletion of reduced glutathione in normal and cataractous lens. Human cataractous lenses showed decreased activities of glutathione reductase, glutathione peroxidase, catalyzing reduction of organic hydroperoxides, including hydroperoxides of lipids, superoxide dismutase, but no signs of depletion in activities of catalase or glutathione peroxidase utilizing hydrogen peroxide. Our findings indicated an impairment in peroxide metabolism of the mature cataractous lenses compared to normal lenses, to be resulted from a deficiency of reduced glutathione. An oxidative stress induced by accumulation of lipid peroxidation products in the lens membranes during cataract progression can be considered to be a primary cause of reduced glutathione deficiency and disturbance of the redox balance in the lens. It seems essential, accordingly, to improve the capacity of the lens to withstand oxidative stress induced by lipid peroxides, since the opacified lenses have reduced activities of lipid peroxidases that would use glutathione as a substrate. The increased concentration of primary molecular lipid peroxidation products like diene conjugates, lipid hydroperoxides, and anfluorescent lipid peroxidation products were detected in the lipid moieties of the aqueous humor samples obtained from patients with senile and complicated cataracts as compared to normal lenses. Human cataractous lenses show decreased ability of glutathione peroxidase catalyzing reduction of organic hydroperoxides, including hydroperoxides of lipids. The apparent Michaelis constant for tert-butyl hydroperoxide was 0.434 millimolar for human normal and cataractous lenses glutathione peroxidase. When lenses were exposed for 1 hour at 37 degrees Celsius to linoleic acid hydroperoxide 0.5 millimolar or EC phosphatidyl hydroperoxide in liposomes suspended in the incubation medium, normal, immature, and mature human cataractous lenses showed a significant loss in the residual content of liberated linoleic acid hydroperoxide, but little or no reduction was observed with phospholipid hydroperoxide in liposomal membranes. Human, rabbit, or mice transparent or immature cataractous lenses induce significantly more absorbance changes in conjugated DN, iodometric, and TBA reactive substance measurements when incubated with liposomal membranes, which were decreased in the presence of free radical scavengers and antioxidant enzymes, a DTA, superoxide dismutase, carnosine, chelated iron, catalase. Injection into the vitreous body of the rabbit of a suspension of liposomes prepared from phospholipids containing lipid peroxidation products here induced the development of posterior subcapsular cataract. It is apparent, you can see this cataract, yes, very obviously, this opacified area. It is apparent from our findings that membrane-bound phospholipid hydroperoxides escape detoxification by the lens enzymatic reduction. The lens cells containing these species would still be vulnerable to peroxidative attack, which trigger the phospholipid hydroperoxide-dependent change, propagation of lipid peroxidation, and other damage, lipid and protein alterations. The lens fiber cell membranes is the site of oxidation-induced precipitation of cytoplasmic proteins, eventually producing aggregates of proteins around membrane micelles and fragments that serve as scattering centers. Cross-linking of biomolecules by the reaction of the carbonyl groups of malonic dialdehyde and amino groups of amino acids, proteins, nucleic acids, and their bases, and phospholipids produces lipofuscins, which are fluorescent sheaf-based conjugates. This results in the formation of high molecular weight aggregates chronically accumulated in cataracts and increased in ripe cataracts, as well as inactivated enzymes in the lens. New therapeutic modalities to cure age-related cataracts and cataracts in systemic diseases should treat the incessant infliction of damage to the lens cells and biomolecules by reactive lipid peroxides and oxygen species and refashion the affected lens membranes in the lack of important metabolic detoxification of phospholipid peroxides. Recently, we have originally discovered that some natural compounds of the peptide character of their metal helates may be among the most potent lipoperoxidase mimics that have ever been designed. Carnosine and its ophthalmic prodrug N-acetylcarnosine can be assigned to this group of products. The advantage of these compounds as antioxidants deals with their ability to give efficient protection against lipid peroxidation, both in the lipid phase of biological membranes and in an aqueous environment. Various protective antioxidant enzymes, such as superoxide dismutase or catalase, can only react with their substrates in the aqueous environment. These molecules are endowed with lipid peroxidase and hydroxyl radical scavenging antioxidant activities, as demonstrated in our studies. For comparison, the classic selenium-dependent glutathione peroxidase lowers the level of lipid hydroperoxides in the cell membranes only under their stripping with phospholipase A2. It would seem that our lipid peroxidase mimics may have practical promise in the therapy and prophylaxis of cataracts. Previously published data suggest that carnosine has excellent potential to act as a natural antioxidant with hydroxyl radical and singlet oxygen scavenging activities. However, exogenous carnosine entering the body intravenously, intraperitoneally, with food, or topically to the eye is not accumulated by the tissues, hopefully, but is excreted in the urine or destroyed by carnosinase, a dipeptidase present in blood plasma, aqueous humor of the eye, liver, kidney, and other tissues except muscle and probably lens. Among dipeptides of the carnosine family tested as potential substrates for a highly purified human serum carnosinase preparation, N-acetylcarnosine and a few other compounds were not hydrolyzed, thus promising a prolongation of physiological responses to therapeutic treatments. A knowledge of corneal and artery ciliary body esterase activity in particular acetylesterase. And in addition to esterase, they identified N-acetyltransferase activities, prompted the development of carnosine for ophthalmic application as an antioxidant, as the chemically characterized N-acetylated form of the dipeptide. Due to its relative high hydrophobicity compared to carnosine, N-acetylcarnosine might cross the cornea of the treated eye gradually and maintain longer the concentration of the active principle, reaching the aqueous humor. The naturally occurring compound N-acetylcarnosine has been proposed and patented by our team as an ophthalmic prodrug of carnosine that is resistant to enzymatic hydrolysis by carnosinase. Rabbit eyes were treated with 1% solution N-acetylcarnosine, carnosine or placebo, and extracts of the aqueous humor from the anterior eye chamber were analyzed for imidazole content by reverse phase analytical HPLC. Here is presented the result of analysis, thin layer and ion exchange chromatographic techniques. The topical administration of pure carnosine to the rabbit eye did not lead to accumulation of this compound in the aqueous humor over 30 minutes in concentration exceeding that in the placebo-treated matched eye. Here you see very distinctly the peak of carnosine and minor, negligible traces of N-acetylcarnosine upon its topical installation. N-acetylcarnosine showed dose-dependent hydrolysis in its passage from the cornea to the aqueous humor, releasing carnosine after 15 to 30 minutes of ocular administration of the drug in a series of therapeutical modalities. Installation, less or equal to subconjunctival injection, less or equal to ultrasound-induced pheresis. Different treatment techniques showed excellent toleration of 1% N-acetylcarnosine by the animal and human eye. Once in the aqueous humor, carnosine might act as an antioxidant and enter the lens tissue when present at effective concentration 5 to 15 millimole. N-acetylcarnosine has been proposed by our group to treat ocular disorders which have the component of oxidative stress in their genesis, mainly age-related cataracts, glaucoma, retinal degeneration, complications of diabetes mellitus. 1% N-acetylcarnosine can be effectively combined for ophthalmic application according to our data with other medicines, such as beta blockers to treat primary open-angle glaucoma. We made some studies on the quantitative assessments and monitoring of cataracts. We have developed a method of classifying cataract changes in excised human lenses based on separate and independent photographic documentation with consequent quantitative evaluation of lens opacifications. Our methods have included a texture image analyzer, optical density indexing, image forming systems, equidensity, photoslit lamp measuring, electronic image analyzer, morphometric techniques and ophthalmoscopy for glare test, patented by us, stereocinematographic or slit imaging, and retroillumination photography. These tests have enabled us to measure transmissivity, the degree of lens clouding and density, lens opacification, glare sensitivity, and of course the precise topography of the lens opacities. You can see in another hole this data. Our clinical studies are following, all published in the United States. In our clinical study, we prospectively evaluated the effects of a 1% topical solution of N-acetylcarnosine on lens opacities and visual function in patients with cataracts. It was designed as a randomized placebo-controlled study. 49 subjects, volunteers, 76 affected eyes with an average age of 65 plus minus 7 years were enrolled and randomized into 2 groups at diagnosis of senile cataract. Changes in lens clarity were measured and quantitated over 6 to 24 months thereafter. 26 patients, 41 eyes, were allocated to topical N-acetylcarnosine 1% eye drops twice daily. The control group consisted of 13 patients, 21 eyes, who received placebo eye drops, and 10 patients, 14 eyes, who did not receive eye drops. All patients were evaluated at entry and followed up every 2 months for a 6-month period, trial 1, or at 6 months intervals for a 2-year period, trial 2, for best corrected visual acuity and glare testing. In addition, cataract was measured using stereocinematographic slit images and retroillumination examination of the lens, typical for ophthalmologists. The distribution of cataracts in the examined patients of trials 1 and trials 2 are shown in the slides. Most of the lens changes in the baseline examined cases were early and moderate. Cortical, posterior subcapsular, a mixture of grades 1 to 3. With the exception of corticonuclear mixed and nuclear color Brunnerson cataracts with more pronounced opacities. Intraoperator correlation coefficient was obtained as repeated measurements for each combination of operated eye, right or left, image analytical characteristic, and glare radius at red and green targets. Overall, the reproducibility for the one operator was good. The intraoperator results for 2 visits with small interval were average and mean between subject variance and extra variance for repeated readings were calculated all. Here, 3-dimensional computer graphics shows a lens with cataract left before and right after treatment with N-acetylcarnosine for 4 months, and displayed this special technique by this special technique, and was co-evaluated with the optical wedge scale. The digitized constitution of the lens opacities demonstrate a smooth, significant decrease. Of optical heterogeneity in the lens posterior cortical region after treatment with N-acetylcarnosine. Next slide summarizes the effects of study treatment on visual acuity, glare sensitivity, and image analytical measurements over 6 months, trial 1, and on visual acuity, photo slit temp, and image analytical assessment over 24 months, trial 2. In the control group, comparison with baseline values showed some variability in densitymetric readings, gradual worsening of glare sensitivity, and minimal visual acuity changes over 6 months, and a decrease in visual acuity and increase in image analytical characteristics after 24 months. Glare sensitivity indicated changes in lens clarity when densitymetric readings obtained at the 5 to 6 months follow-up examination did not differ significantly with baseline. In the N-acetylcarnosine treated group, 6-month follow-up showed an improvement in visual acuity from 7 to 100% in 37 of the 41 treated eyes, and a significant improvement in glare sensitivity at red and green targets from 27 to 100% was documented in 16 of the 18 eyes tested. A significant improvement in lens clarity was found in 17 of 41 eyes, trials 1 and 2, as documented by a significant decrease of image analytical characteristics. The data obtained by the same observer in the trial 2 illustrate examinations over 24 months of the 23 eyes treated with N-acetylcarnosine to show that the effect of treatment is sustainable over more prolonged periods. 20 of the 23 examined eyes showed a 12 to 67% of improvement in visual acuity, and the remaining 3 eyes were unchanged at the 24-month follow-up. Image analytical characteristics showed a significant improvement ranging from 11 to 49% in 11 eyes, and 12 eyes were unchanged. In 41 eyes with different localization and grade of cataract, Prolonged treatment with N-acetylcarnosine did not seem to result in a worsening of the final 24 months visual outcome. The overall clinical results observed in the N-acetylcarnosine treated group in the 24-month study differed significantly from the control group. The overall visual outcome in the control group showed significantly worsening after 24 months in comparison with both baseline and the 6-month follow-up examination. Topical, short, or long-term administration of 1% N-acetylcarnosine to the eye was very well tolerated, with no ocular or systemic adverse effects, no hyperemia of conjunctival vessels, and no signs of allergy or other toxic manifestations being reported. All patients completed the study without any problems related to their allocated treatment. The maximum positive effect of treatment with 1% N-acetylcarnosine eye drops is exhibited during a period of treatment of average 5 to 6 months. The total study of 2 years revealed a sustainable effect of 1% N-acetylcarnosine. We have evaluated an original pharmaceutical N-acetylcarnosine aimed at reversing cataracts in order to avoid the need for surgery. This ophthalmic drug shows potential for the non-surgical treatment of age-related cataracts and has been shown to have high efficacy and good tolerability. We would like to demonstrate for you some typical cases of the application of 1% N-acetylcarnosine solution in eye drops to cure cataracts. The N-acetylcarnosine anti-cataract eye drops have been carefully tested in animals first. We have processed the treatment of age-related cataracts in canines. We have determined the efficacy of cataract treatment, and we have revealed an absolutely new phenomenon of melting snow, we title it, upon the installation of N-acetylcarnosine for the chronic treatment of cataract within only 1 month. You see, posterior cortical cataract, and this age phenomenon, we title it melting snow. So the cataract can be reversed with our remedy. The cortical appearance of cataract reversal starts from the periphery, as you can see, and then the lens becomes more transparent. This improvement detected with retroillumination photography is then accompanied by the improvement visual behavior of the animal. I can add this is age-related cataract. Rigorous computerized image analysis has been supplied to support the evidence of the cataract treatment in rabbits. The photos from top to bottom clearly show the reduction of cataract in rabbit eyes under treatment with N-acetylcarnosine eye drops. The striking results of reversing cataract and the prevention of the lens opacities are clear and have been revealed in traumatic and liposome-induced types of modeling cataract. Here is another case of successful treatment of cataract in a rabbit with traumatic cataract presented after 10 days of topical treatment with 1% N-acetylcarnosine eye drops already. We would like to make clear that we have used in our experimental and clinical studies only pure CGMP-produced N-acetylcarnosine bulk material to prepare eye drops. And this is our know-how procedure, developed process and technology owned by Innovative Vision Products, United States-based company. The N-acetylcarnosine eye drops contain a 1% solution of N-acetylcarnosine in phosphate buffered saline and show good stability. In conjunction with our Japanese business partner and manufacturer, we have developed and synthesized pure N-acetylcarnosine, which has biological activity to cure cataracts. The product has been tested in the human lens study. We would like to know that if N-acetylcarnosine is received from any other source, its activity is very, very low. Please see the number of demonstrative examples to cure human cataracts. You see, left Prior treatment, human eyes, red reflex, reversal of cataract. The same upper image, prior treatment, below, after treatment. Well, the next. The arrow you see on the right slide, the arrow on the right image shows the areas which became more transparent upon the topical use of 1% of N-acetylcarnosine in eye drops after 4 months for treatment of human cataract. Okay, the effect was also monitored in the human lens studies in organic culture. The effect of 1% N-acetylcarnosine to reverse human mature cataracts freshly received after extracapsular surgery is demonstrated with computer image analysis. So you can see that the cortical layers of the lens become transparent, so the same tendency as in vivo situation. The method enables to monitor the kinetics of the process to cure and reverse human cataracts. The kinetics is prolonged within 45 minutes. And the cortical layers of mature cataracts as human lens become more and more transparent. The next. Here you see cortical layers of mature lens become objectively transparent, measured with computer analysis system. Even pronounced cases of cataracts are possible for the therapeutical management in canines with topical 1% solution of N-acetylcarnosine in eye drops. The blue areas, you see the blue areas in the side denomination provided in the cortical areas of the lens become more transparent. On this slide, the reversal of canine cataract, the extensive areas of blue zones expresses the appearance of the lens sutures even. Here you see lens sutures, which is the evidence that the lens becomes more transparent. A property of transparent lens. Here, the extensive areas of red tongue-like reflex in the retroillumination image of canine cataract demonstrate the reversal of posterior cortical cataract. You see this rose reflex in retroillumination is the lens becomes clearer. And here is posterior cortical cataract. The next slide is demonstrating the look of the canine lens upon the reversal of the over-mature even cataract within 23 days of topical treatment with 1% N-acetylcarnosine eye drops. You see, absolutely white, over-mature cataract, and the anterior cortical layers of the lens becomes more and more transparent. Next, for your satisfaction. Here, again, the same tendency. The cortical layers of the canine age-related cataracts become more transparent. This tendency is in line with the reversal of cataract in the organic culture of the human lens. Here. As a result of cataract treatment with the drops of N-acetylcarnosine for 3 weeks in human patients, the cataract becomes reversed in the upper segment of the lens. You see this segment, and now is more transparent, reversal. This effect was followed up for 3 weeks in human patients. The cataract becomes reversed in the upper segment of the lens. The next. This couple of slides demonstrate the result of treatment of human ripe cataract with 1% solution of N-acetylcarnosine for the time period after 5 months. Red reflex. See? Next. Finally, please see the result of topical treatment with N-acetylcarnosine in eye drops of the posterior cortical cataract of a woman after 5 months. Initial upper image shows the appearance of cataract which resembles a bat with its form. A bat. And here, These types of opacities disappear after the cited period of 5 months of treatment with N-acetylcarnosine is completed. The lens becomes clearer. So what have we done? What have we achieved? We know that senile cataract is a very common disorder, and maybe because it has been treated successfully with surgery for so long, that many researchers have overlooked the possibility of a non-surgical approach. However, as has been clear in my presentation today, the high cost of surgical procedure, the limited number of trained surgeons, the potential risk of surgical complications, and the simple fact that a replaced lens is not as good as the natural lens makes a non-surgical procedure, such the N-acetylcarnosine eye drops, a very, very attractive proposition. Our research now shows the world the real possibility to reverse and maybe even prevent senile cataract with eye drops has arrived. I'm confident to conclude that in the years to come, this type of approach is going to radically alter the course of the treatment and prevention. This has been accepted by the prestigious United States-based ophthalmic journals, so we can decide to cure the age-related eye disease like cataract. So this concludes my presentation, and thank you very much for your patience.